could just sort of off the cuff uh, offer some advice or some guidance to someone that's maybe starting a chronic illness journey. So maybe they're still in the pre-diagnosis space, they're still, moving towards that. And then maybe some guidance for someone that has received the diagnosis and is now kind of moving into that next phase. No pressure.
Yeah, so as far as like if if you don't have a diagnosis yet, I think there's like pillars of support. I think finding even just the tiniest bits of safe community, like people who will hear you and understand you, because I think that we need to keep our batteries, like that emotional battery, as charged as we can, and that will help navigating a lot easier so that we know we're not the problem, we're doing our best, this is okay. And lots of people are legitimate without diagnosis. You don't need a diagnosis to have your lived experience be valid. um, the other piece is, give yourself patience. Sometimes you will need to go into the medical system for assessment, and that can be really important. And sometimes you will need to give yourself a break because um, sometimes it can come with health, and sometimes it can come with like, it can feel kind of draining or devastating, because the stakes are high and because we're just dipping into people, and dipping out, and but we're living it all the time. The other piece I feel strongly about, and this is partly living with brain injury and visual impairment, is I make notes. So I might even struggle to see the notes later, but I make notes to help me kind of orientate what is the key points. So it was sad that I had to leave a lot of my symptoms out, but I really focused on what are the hard to ignore symptoms. So for me, I focused on neurologically what's happening. I started to try to understand that even though there was variables in when my symptoms would happen, there were still trends. Um, I learned to, after an appointment, actually write what they asked me so that I could give myself time to think about it. Because something I really came into challenges with is I on the spot I couldn't think, like I couldn't think of it, I couldn't remember. But if I was in my day to day in the weeks after, I was able to observe my symptoms, I was able to observe myself, I was able to see, okay, this is consistently happening. That gave me more trust in myself, and then I was able to communicate it to my physician later. And that didn't just help me communicate better to my physician whether they would hear me or not, it helped me feel more confident in understanding what was happening, which was a really important piece for me. And then the other is if you have visual impairment or brain injury or whatnot, how you write it out, how you space it out, having highlighted parts so you can glance at the words so that you can see it and follow, but still have the cognition to understand what the person in front of you is saying, because that is a whole other juggling act. Um, and then for post diagnosis, um, it's tricky because I think we put a lot of weight into getting a diagnosis and that's going to help. But often getting a diagnosis can mean, okay, it's got a name now, and now what? And there's such a disconnect in resources too. So sometimes you're like, okay, like, well, what should I do? Like for me, like complex neurology to complex brain, vision, vestibular, balance, um, dystonia, like it's like, well, where do I go and when? And so it's also, trying to find those pieces where you're patient with yourself. So like even just to, instead of it circling in my mind, writing out on a piece of paper, like here's 4 directions of therapy I could go in, so that I know that it's there and I can kind of glance at it. And then I can kind of, when I think of it, ask a person a question. What has your experience been with this? Um, and how was that physician for you, and trying different things? And then post diagnosis, also being compassionate to yourself to understand that, like, you know, people think when you get diagnosed or you get a treatment that you're better, but you can get diagnosed. There might not be a lot of treatment options. You can get diagnosed, you can get treated, but they might only, in my case, they dealt with my most severe pathology that saved my life. And thankfully, I'm walking again and I've got some improvements. But I have a myriad of symptoms, and that self compassion, where earlier on I had a hard time inventory. You asked me a question like, how do I explain this? Like, how do I explain my day? Like, that self compassion, that just because I've had success in one area doesn't mean it's not still hard to figure out, how do I communicate my life to people? Like, how do I say this? How do I not feel ashamed of it? Because I'm a very hard worker, but what I have to show for myself looks fundamentally different than what people think of as a life full of hard work. And so I think it's just that tricky piece of like, being in the ebbs and flows of that and the emotion and the pain. And then the last piece of advice I would be is it's okay for some people if the emotions get really big, the anger, the frustration. We're all different. But I know for myself, I really try to focus on what can I take care of? So I might not be able, like, we're such a results based society. So people are like, you're doing this, what's the result? So I don't need to see the result to know what I'm doing is useful. It helps me with pain, it helps me with, coordinating my body, all these pieces. And so I just have to find ways to remind myself that that is valid, and then maybe say it to, like, someone like you, where I say it out loud. I feel afraid saying I work so hard because I'm like, oh my god, is this going to be seen? But then having someone see it back and feeling understood, and that whole piece, just those little snippets, whatever we can get as an anchor point, and then to recognize that we deal with different types of people. Sorry, this is the last thing I want to say is, in the medical system, like, there's all sorts of people, right? It's like saying everyone in Canada is exactly the same and they're all perfectly nice. They're all different. And in a medical system, they're all different. And in a medical system, there's also, sometimes we're dismissed, but there's limited, dollars for care. So they're trying to do their best to figure out who to help, who not to help, and like, try to find ways to, yeah, just find those people who are a little bit, who hear us a little bit better, and to really anchor on to that, because we might feel the fierceness because that's self-protection, and that serves a purpose to a point, but how do we move forward from there where we can kind of be in motion?
Want to thank you so much for sharing so openly. I
Thank
feel
you.
like there's something really powerful about hearing the truth spoken from inside the experience, not just from like a medical chart or like a research paper. I think that these
Yeah.
conversations, they matter because they bring visibility to what's often kept in the dark, and remind all of us
Hmm.
that we're not alone. So thank you so much, Rachel, for joining us today.
Thank you.